South Africa has breached the 3,000 mark for daily new COVID-19 cases. That's more than half of these from the Eastern Cape. There are also concerns that the positivity rate is at 12% rather than the desired rate of under 10%. The Health Minister, Dr. Zweli Mkhize, joins us now on Zoom. A very good evening to you, Minister. Thank you so much for speaking to us. So this figure of 3,000, is it over the past 7 days?
No, it's a 24-hour number of positive cases that we have been tracking over the past few months. So every day we do tests, and then we had gone from 13,000 on 24 hours in the mid-July, went down to about 3,000 around the beginning of September. It came down to about 2,000, and in fact, we weren't even close to 1,000 at some point. But we have now seen that the numbers have started moving up, and in particular, in the past 3 weeks, we have now been around the 2,000 mark. But today, we have actually just breached 3,000, and 54% of those are actually coming from the Eastern Cape. And so our concern is that this is a new wave we're seeing in the Eastern Cape. It still would be classified as a cluster outbreak, but certainly the numbers are increasing, and it's a new wave that's coming up. So we would like to see a way of trying to contain this so that it doesn't spread throughout the whole province and the whole country.
And Minister, there is a reason. Obviously, 3,000 is a significant jump from the 2,000s that we're at. But you did mention in your last address to the media that you will be tracking that 7-day period if there's going to be a 20% increase, which would then qualify as a resurgence. So it's just really trying to put that into context. How should we look at this 3,000 within 24 hours?
Well, 3,000 in 24 hours just indicates that the numbers are increasing. When we do the calculation, we look at it over a 7-day period. But I think the point which we are not able to run away from is the fact that the numbers are increasing. It's a new wave. It's not the same old. But if you compare with the other provinces, you can, for example, say that in the Free State, what we're dealing with there is a declining number from the first wave, which was delayed, same as in the Northern Cape and Limpopo. But right now, the Eastern Cape is different in that it was much lower. The numbers are beginning to creep up, and that's why we're sending the message that, look, we are now going to get into troublesome waters, and it's important for us to be aware as this is happening, because it now means everyone everywhere needs to take precautions.
And also the definition of a resurgence. I think we've heard about these concerns for a number of times, but I understand Professor Salim Karim saying that the Eastern Cape is very worrisome, and the increasing number of infections even more so, but that for as long as it's contained, we won't so much be speaking of a resurgence. But if it does move on to other provinces, then you are going to then have to seriously look at the situation. Indeed.
It's not the only province that has had cluster outbreaks that we're worrying. We've seen those in some of the areas. We've seen a little bit of that in Tshwane. We've seen some of that in the Western Cape. But what happens, it tends to be contained, and therefore it disappears before it creates a trend that needs to be calculated. Now, in this case, in the Western Cape, if you in the Eastern Cape, when you look at the numbers and talk to the hospital staff, the clinicians, and you talk to people around, they're actually feeling that there is an increasing number of patients who are infected. And so we are saying, at this point, we're dealing with it because, we can break down into a number of suburbs and townships where the numbers are coming from, that it can still be contained as an outbreak, a cluster outbreak in those particular areas. But the message has to be, everyone needs to take precautions. The issue of use of masks, distancing, and hand washing, sanitizers is even more important in those areas. But it also means we must do that everywhere else in the country, because we can now expose ourselves to the risk of this outbreak getting out of hand to become a big problem.
I mean, we were speaking about vaccines earlier on, the development thereof. And I just want to understand the coronavirus infections that we're seeing in South Africa from province to province. You were speaking about the importance of the geographical district in terms of the cluster outbreaks and the rising number. Has there been a different strain that has emerged, or are we still dealing with the same strain? I know you did mention that some provinces are lagging behind in terms of the infection, that they are still within the first wave. But has there been another strain of the coronavirus that has emerged in some of the new infections in the Eastern Cape, perhaps?
Well, at the moment, we're not having any information to suggest that there's a new strain there. It's just that we never really completely got rid of the same virus, viral infection. So we believe it's still the same strain. We have been watching over the media to look at where there are issues being reported. There was a concern, for example, in the northern countries like Norway, Denmark, and so on, where they actually saw that the coronavirus jumped back to the animals, which were the mink cats, and in the process, they had to cull them because of the fear that when it has reinfected the animals, it may mutate and then come back as a different strain. So it's an area that we always wait for new information from scientific research. At the moment, we don't have that, so we have to deal with it as it has been. And even the vaccines that are being developed on the same basis that we're dealing with the same virus. But of course, scientists will tell us when there's a change.
Of those 54% of the 3,000 that have been reported in the past 24 hours in the Eastern Cape, has there been also a commensurate increase in the number of hospitalizations?
Certainly, the numbers of people who are testing positive is increasing. The numbers of people who are being admitted in hospital is increasing, and those going to ICU is increasing, and the mortality is also increasing. And all of this is an indicator, as well as what we call the positivity rate, where you will check for every 100 people how many are positive. Then that number has increased to about 27 in the Eastern Cape, although in the whole country it was still around 10, and today it's gone around to 12%. But it's an indication that there is certainly an increase in the number of new infections in the area of the Eastern Cape, and almost 45 to 50% of them are in the Nelson Mandela Bay. Of course, the other areas that are affected, mainly the Sarah Parkman region bordering the Western Cape, and also Buffalo City, and some of the others are showing activities, but the thrust of it is in the Nelson Mandela Bay.
Minister, I understand that you have a resurgence plan that is in place. Now, should you see an even greater increase over the past couple of days, and I'm talking nationally here, is there a move afoot to reopen some of those field hospitals that had to be closed when we saw the numbers going down, and particularly in the Eastern Cape? Is that underway?
Yes, in the Eastern Cape, the one big hospital which was donated by VW has been occupied. They've actually increasing the number of patients in there. I think about just under 300, 280 or so. So they have opened it up for admissions. Some of the areas, such as some of the hospitals, such as Doranginza, has reopened new beds which were not used which were not available during the July surge. So they've now reopened additional beds. Livingston has also opened some of the older parts of the hospital that were not in use, so refurbished and now being used again. So there is obviously now a need to use beds that were not necessarily used before. There's also been concern about areas where there might be beds, hospitals getting filled up, that they need to redistribute to the other parts of the other hospitals in the neighborhood. So all of that is being done now as a way of accommodating this rising number of positive cases.
Thank you so much for speaking to us, Health Minister Dr. Zweli Mkhize, just telling us that the number of COVID-19 infections have gone up by 3,000 in the past 24 hours. Reason for concern. So that brings 762,763 cases in the country, the number of cases, and 54.4% of those are in the Eastern Cape, and he's also concerned about the 12% positivity, which is higher than the ideal, which should be, as he says, 10% less. So do please continue to take care and take those non-pharmaceutical precautionary measures that of sanitizing, wearing your mask, social distancing, that government has been continually appealing that we adhere to.